So I'm really excited to see y'all. If I'm not mistaken, it was our, let me see, it was our fourth construction project. It was just a vacant lot in the neighborhood when we purchased it and partnered with the city to develop it as affordable housing at the time for families. So it's 3 bedrooms, 2 baths, and then 2 bedrooms, 2 baths, underground parking, elevator service, rear kind of garden, backyard for some kids to have private places to play. And so people that are there are if someone is living with or impacted by HIV. At some time early in the days, there might have been a child that was born HIV positive. We haven't had that in a long time because of education and getting those mothers to the doctor and getting on medication. So to prevent that, but that's a whole other situation. So anyway, today we're just going to talk and kind of hear from you and hear what your interests are, and then talk about your experience at K-State and answer questions about ASD as much as I can, because I went to Kansas State a long time ago. Busted out my old letter jacket. I ran track and played football at Kansas State. And I came from this neighborhood. I was from Dallas. I came out of Richardson High School. So Kansas was weird to me. It was a culture shock coming from the big city to Manhattan, but it was really a great experience to be in Manhattan, the Little Apple, and enjoy all the things. And now when I go back, I'm like, man, this is a big city. Manhattan's not a little small town anymore like it was when I was there. So gonna talk a little bit about, well, I want to hear from you. Just tell me your names, and if you can, tell me your name, your major, and if you've ever been to Dallas. We'll start.
I'll start first. So I'm Maddie Pike. I'm a first year Master's of Public Health student, and I'm actually from Waco, so pretty close. So
Okay, yeah, okay.
So it's not. I know the roads. I'm the driver, so super fun.
Okay.
I'm Josie Coloma, and my major is biology with an emphasis on pre-dental.
Okay.
And I've never been to Dallas before. This is my first experience, but so far it's been super enjoyable. So,
Okay. Where are you from, Josie?
Chicago.
Chicago, Illinois. Yeah. Okay. The Windy City.
Yep.
All right.
Not a big city, but I'm used to it.
Okay. Cool. Welcome.
Hi, I'm Roberto. I'm a human health biology with an emphasis in pre-medicine. I've been to Dallas once when I was a kid, but don't remember it. So this is really my first time, I guess, actually being here.
Okay.
But yeah, roads are crazy.
Okay. Where are you from?
Originally from Mexico, but raised in Wichita, Kansas.
Okay. Wichita, Kansas. Did you finish high school in Wichita?
Yeah, I did.
Which school?
West High School.
Okay, West.
Yeah.
Is that the blue and yellow?
No.
Or the red?
Oh, maroon and yellow.
Okay. Yeah. Okay. All right. Good.
My name is Mary. Sorry. My name is Mary Adeyemo. I'm an English major. I study masters in English, and I'm my first year. This is my first time in Dallas, and I'm from Nigeria.
Okay. And what year? It's your first year in K-State?
Yeah, it's my first year.
Okay. Are you a freshman?
Technically, but a master's student.
Master student.
Yeah.
Okay. So you're doing a graduate school?
Yes.
Okay, because when you say you're a master student, that's what you, okay, master level. Wow. So how many master's graduate students we have? Just three? Okay. Wow, nice. I don't know if we've had graduates. Have we had master level graduates here before? Wow, that's nice. Still doing community service. That's great. Okay. And wait, pronounce your name one more time.
Mary.
Mary? Oh, okay.
Hi, I'm Autumn Mount. I go to K-State, obviously. I'm from Kansas. My major is psych with a minor in child development.
Okay.
Yeah,
Where are you from?
Kansas.
Where in Kansas?
Holton, Kansas.
Okay, Holton. Okay. All right. I know where Holton is. All right.
Real small.
Yeah, my wife is from Liberal, Kansas, so I think they're neck and neck with size. But okay.
My name's Henry. I'm
Henry?
a sophomore.
Okay,
at
Henry.
K-State. I'm studying kinesiology. My brother lives in Dallas, so I've been here a couple times.
Okay.
That's been a while.
And where are you from again?
Kansas City,
KC? KCK?
Prairie Village.
Okay. All right. Nice.
Hi, my name is Comfort Kafui Kwame.
Okay.
I'm from Ghana, and currently I am pursuing masters in horticulture with an
Horticulture.
emphasis in urban food system.
Oh
I've
my
been to
gosh.
Dallas before to visit my friend, and this is my second time.
Oh my gosh. Wow. Okay. Yeah, I'm sorry. You have to say it one more time, your first name?
Kafui Comfort Kwame, like
Okay.
car, like car,
Yeah.
and then fui.
Fui.
Yes.
Kafui.
Yeah.
Okay. Wow. Nice. Nice. Man, what a range of people. So and students and levels of so wait, I just want to be clear. Any freshmen or sophomores? True freshmen.
Well, like, sophomore.
Sophomore. Second year freshman?
Transfer.
Okay.
Technically a freshman.
Okay. I just wanted to see, as far as like college experience or whatever, with all these graduate students here. Wow. No, that's so great, and that's why we try to ask, or I ask, because when I was a freshman or sophomore at K State, I didn't even dream of doing this, and I didn't dream of this as a career. So I always ask what kind of majors people have that are crossing our path, just so that we can kind of give you information on the range of exposure that we have here as industry or career. We're a nonprofit. We're known as what they call a CSO, community service organization, kind of in the federal world. We have federal grants, but we're a nonprofit that is, focused on people that are living with, impacted by, or HIV or AIDS, and that are low income. And we focus on the people that are have low income, and mostly that is homeless, coming out of a homeless situation. So I'm going to introduce the room as well, because this is not what you see here is, it couldn't be done without this great team that supports us. So I'll start here with Dr. Dumais that you see here in the green. Christine is in charge of our development, community service, volunteers, and everything that we do with media and all of that, communications and so forth. She's got a great experience and background. She's new here. She has been here a year, but does great work for us. So everything you see mostly comes from her team. And then you see Jermaine Nation there, chief of staff. He's also kind of my support for everything we have administratively here. He really helps and kind of keeps a prick on me on making sure that we're doing what we're supposed to do and on time and everything of that nature. And then Darius, who's not here, he's our director of services. He is in charge of basically the campus case management and the housing stability for all of the residents that we have. So that means when we say housing stability, it may be medical case management, maybe nutrition, it may be housing case management, it may be socialization, it may be their rental situation. But he's over that team of providers on the campus side. I mean, Alex has been here almost 11 years.
11 years.
Yeah, 11 years. He just celebrated 11 years, and always involved with the students and recruiting for your experience and your hosting. So he puts all of that together, as well as working with maintenance on the projects for community service. Does a great job with all of our social and graphics and anything that you see that's like, wow, look at that tech. Now Alex did it. So he's our kind of our wizard for that.
Yeah. Well, thank you guys again for being here. We appreciate y'all, and I mean, you guys are going to have a great time, so get ready.
And then behind the scenes, because this again is something new that we wanted to be able to have as a showcase for future students that may want to come, or students that didn't like, nah, I don't think I want to come. It's probably not going to be fun. to record and kind of get them some moments to kind of be inspired to come and get off the fence and like, yeah, you can do this too, and come out here and have fun and learn and be in a different area and it's safe and enlightening. And that's our media group with Terry Brown behind the scenes. Our Joe Media, they're helping us kind of with the production of everything. This year, like I said, we wanted to bring you here to our Education and Learning Center. We haven't been here a year. It's only been probably about 9 months in this building. And this room is our Education and Learning Center. So the vision in here was to do this, to be able to bring people that are normally wouldn't cross our paths, to tell them a little bit about ASD, because as a nonprofit helping people get out the message and fight stigma, it's important for us to talk to as many people as we can, not just the people in healthcare, not just the people in public administration, not just the people in housing, but to everyone, because that's how we fight stigma. That's how we end HIV and internationally. It's just pushing down those walls and barriers. So that's why you're here. This room is just kind of, again, it's just, I want you to make yourself at home and feel comfortable. We've got snacks and donuts, but we're just going to talk a little bit about your experience at K-State, ask questions about what we do, and then talk about the week and everything. Alex, you want to kind of give us a
little bit.
a rundown of what we're doing? Or
It'll be at the end.
Okay, cool. All right, so like I said, Alex has helped. Oh, you got me. You got some graphics here. All right, cool. Oh yeah, so so this is just a few slides just talking about Dallas. So again, not knowing who was here, who's from here and been here, but you are in a historic part of Dallas. Everybody knows John F. Kennedy, right? You've heard of John F. Kennedy? So John F. Kennedy was a president that unfortunately was assassinated in Dallas. But when the shooter, after the shooting, the shooter came down here to this street, Jefferson Boulevard, went into the movie theater right there, and the house that he was living in is right around the corner from our properties as well. So this is a historic part of Dallas, not just because of incidents, but because Oak Cliff used to be its own town. It wasn't part of Dallas. So that's where you're at. And in this neighborhood is called Bishop Arts. And Bishop Arts is just a neighborhood of markets, retail stores, restaurants, housing, in this old 1920s area. And this used to be a boutique the novelty recording studio next door too. There's a folk singer, there's a very famous recording artist there. But this building is kind of in a historic area. Like I said, in a historic area, we kind of retained the building. We didn't do anything on the exterior of it, but interior, obviously. So I just wanted to know where you are in town. Dallas is a big town, but this neighborhood is historic, and what we do is housing. As a housing provider, we provide confidentiality for our residents as well. So we are not always just branding out, hey, housing over here is affordable. Housing over here has case management. We don't do that kind of marketing. We just have quality housing, and discreetly maintained. Our mission is to provide and to increase housing in the community, provide healthy, stable housing for those living with or impacted by HIV and AIDS. That's our mission. It's our focus to, again, not only provide housing, but housing that is sustainable for individuals, meaning it can't be sustained if you can't afford to live there, right? And we want it to be quality housing, nice living conditions, not institutions. This isn't we don't do shelters. It's not a prison. People come and go on their own. It's a nice quality housing. And our core values are respect, justice, and mercy. And we were founded in 1987 based on those principles, because at the time, before when there was just so much unknown with HIV that people didn't know, and people were ostracized and stigmatized, and they were scared to be engaged, because they didn't want to hurt anyone, or people didn't know. People thought they could get sick just because they were associated or next to someone living with HIV. And do you think that just by show of hands, do you guys think that people still feel that way? Yes, they do. So we still have residents that when they go home, their parents or family members serve them on paper plates, plastic forks, because they just don't know, and or just refuse to listen because the information is out there of you can't contract HIV that way, but sometimes it's just hard to. So anyway, the work we do is important to continue to advocate. And again, we've always been providing housing. Our founders, the two founders, Daryl Moore and Michael Murdian, were our original founders. They were both living with HIV, both contracted AIDS, and both passed away within 5 to 6 years of founding this organization in 1997, 93. Daryl passed away, and in 92, Michael had passed away. Ben, and right before they passed away, they hired a lawyer that was advocating in the community for their rights, and his name was Don Mason. Don Mason was the first CEO here. So everything we really do has started based on his vision and his foundation and his advocacy for what we do. They hired him as this. He left his law practice of fighting for civil rights and became the CEO, and served for 32 years as the CEO here. He hired me in 2011, and then he retired in 2018, 2019. You'll see his picture at the front of the wall. But anyway, this is also a congresswoman. This was the Dallas congresswoman. She just retired about 2 years ago. Have anybody heard of Jasmine Crockett? No. She's a congressman for this area. Anyway, she was replaced. She replaced Eddie Bernice Johnson. And that property is where you're staying, I believe. That was the groundbreaking. So when we built that property, it was the first kind of property in the country that was affordable housing for people living with HIV that included families. It was the first. So we got lots of awards for that development. The reason we show this photo is so that you can see the properties that we develop are intentionally nice. We are not trying to stigmatize people having an illness or people being homeless. Those are situations, that people are dealing with. So we want to provide quality housing. So we intentionally beautify our spaces. That's why we have activities all the time to beautify our spaces, make things fun. We want quality of life to be nice. So you see all of our properties here. Hillcrest. This is our newest property, La Maison. We named after our former CEO. His last name was Mason, so we call that La Maison. Revlon, and then that's where you are. And then Ewing Center, the first property we did. Oh, this is great. So this is the reason we show this is so that you can see the conditions and the quality of the housing. This is, matter of fact, this is Hillcrest House. These are our SRO units, 280 square feet. Anyone live in the dorms? Which dorm? Putnam, okay. I was in Haymaker. Real small dorm, congregate, anyway, that's what Hillcrest House is. It's 16 on each floor, congregate kitchen in the middle, and the dining hall in the basement for breakfast and lunch and dinners and stuff like that. Murphy bed, pull out Murphy bed. So that's that unit. But you can see how nice the finish out is, the built-ins. This is La Maison. And Spencer, okay. Oh, it's very nice. Yeah. So we staged some of the property so that you could kind of see the interior without being intrusive and going into residence units all the time. So we wanted to be able to do both. Thank you. This is great. And then this is our direct service team. This is the nuts and bolts of everything we do. This team, they do all of the work. They're front line. When we had COVID, they were on the front line working day to day, helping people. We couldn't do our services remotely. We have to be hands-on to fix the door or to serve food. So anyway, this is our care team. We've got housing-based case management, our nutritional services. We provide about 4,000 meals a month. We cook it all of ourselves, and it was crazy because during COVID, we delivered it door to door because of safety reasons, boxing it up. I tell my team, man, you guys are better than Uber Eats because you were delivering door to door 4,000 meals a month without any tips. So it was it was crazy, but we pulled it off. But now you'll see in the dining hall, some of the dining halls are used different because you're in a family unit. They have a full kitchen. They can kind of prepare, and it's kind of a family time. So, and we do teach cooking skills. But it's some of the other units where someone was literally kicked out of their house because they identify as LGBT and their parents put them out. So they don't necessarily know how to cook pasta or lasagna or whatever. So they're still kind of learning that. So we have food services every day, breakfast and lunch, and then we do supper clubs as a partnership for dinners. And the supper club dinners are kind of spread out throughout the month, but it's also an educational time for the case managers to work with residents on preparing food when they don't have something, or going to get groceries to prepare food and what they can learn to cook. So it kind of all works together. This is our newest program. Destination Home is a new partnership that we took over. And then we do short-term mortgage and rental utility assistance. That's to help people in the community who are just about to be evicted, and or their house is about to be foreclosed on because they're behind or they lost their job. We help them with that so they stay housed and don't become homeless. Yep. Oh, in the future, we plan on developing. We're doing, oh my gosh, we're working on some developments now. So if you get a chance to see anything, we're doing stuff. I think you said urban gardens, but oh yeah, look at that. All right, this is what we're doing. Not far from downtown. You can kind of see how urban this is. This is about 3, 4, 5 miles, just about 3 or 4 miles north of downtown. Is an area called Uptown, Cedar Springs area. We're redeveloping what used to be the Braniff Hotel. Braniff was an airlines company based here in Dallas, and the flight attendants used to stay at this hotel. They would do the training for the pilots and things like that at the hotel. We're renovating it. It's been vacant for about 35 years. We're renovating it as permanent supportive housing. Permanent supportive housing is a HUD term, but it's basically a term that identifies the service requirements and the population that live there. It means that the people that are living there are formerly homeless and living with a disability and have low income. And to live in Dallas, you need to have a wage of about $21 an hour to afford an apartment. You need about $21 an hour to afford an apartment because apartments are around $1,900 for an apartment here in Dallas. So anyway, doing affordable is important. That's why we're doing it. And this is another development that we're doing. So you've been in Dallas, been to North Park Mall?
We wanted to go, actually.
Okay.
Plans, but not yet.
All right. Well, it's another historic property, but North Dallas is where this property is located, near Presbyterian Hospital. It's on 75, Interstate 75 in Meadow. It's not far from the mall. Right off the Dart line. This was a nursing home that was foreclosed on. It's only about 10 years old. We're redeveloping this. It was 123 nursing home units. We're renovating it and turning it into 1-bedroom units for permanent supportive housing as well. This should be like a December January opening of January 2026. We close on this in June of this summer. We close on the other property in June of this summer as well. So we're doing those two big projects. Oh yeah. Oh, here we are. Are these actual?
Yeah, that was actually my last group before COVID.
Okay. We've had students, mostly K-State, but in the Alex has helped us recruit other schools too. I think Iowa, not Iowa State, Iowa, right? Iowa's come, Texas State University's come, San Antonio, University of Texas San Antonio's come, and then Texas State. UTA come before?
No. Yes.
Yeah. Yeah. And SMU came. Yeah. But anyway, for years. So when you go to the property, have you been to the basement? No, no. Okay, when you go to the property, you'll see different things, different beautification projects. And what we always tell the students, when you do whatever you do, try to put something about, a little number or 2025 or KSU, because so that when the other students come, they'll say like, oh, as a matter of fact, on the corner, when you drive up to the Spencer, when you walk out of the door, there's a school here, there's our apartments across the street, and then there's a mural on the corner by the stop sign. That was a little beautification project where they did a little mural. I forget what it says, but it's got hot air balloons on it, and a little KSU in there from like 2020 or 2018, something like that. But stuff goes back all the way to like, anyway, yeah. But anyway, so you'll see that throughout the property. Just beautification. Again, we can't do this without partnerships. All right. Questions for me? Questions? Yeah.
How much you get in federal grants usually?
How much do we get in federal grants? Money wise or percentage?
Both.
So we get about 80% of our funding comes from the federal government.
What's the other 20%?
The other 20% is what we raise.
Just like through the community, just online doing.
Individual donations, corporate partnerships. Yes.
And what's like the lump sum? What's like the number value?
So we have to raise at least probably 1.6, 1.8 million every year. And we have a budget of 7.1 million. So every year we're charged with, it goes up and up and up. But yeah, our annual budget is about 7.1 million.
How many like employees do you guys have?
So we have about 85 employees. It fluctuates from about 85 almost to 90 based on the part-time work that we have. We have part-time, full-time, and then we have a lot of interns as well. We have a partnership with AmeriCorps Vista. And then we partner with the University or Texas Women's University's Social Work School. And they've placed several. The property manager at where you're staying did an intern project here as a social worker, and then was able to get employed as our property manager. So we do a lot of intern partnerships as well, and and then volunteers. We've got volunteers working at any different time as well. So we leverage as much as we can. To house one person in the place where you're staying would cost. We charge federally probably about $21,000 a year. Yeah, so which is way less than tuition at K-State, and it includes food, transportation, case management, all those services you saw. It includes all of that. But if that individual was living on the streets, it would cost Dallas County citizens about $60,000 per person, because that person would be using the ambulance for their doctor. They would be getting loitering tickets for sleeping in the streets and using the emergency room over and over again for healthcare, let alone just the infections and just the diseases and things, the risks and of being on the streets. So by housing someone, helping them get income, helping them get back to health, we really save public money. More than double. It's like $40,000 a person that we save just by housing them in our program. That's why we want to do more, because it's a better way of housing. In the Dallas homeless population is just around 4,000 people homeless. And by HUD's definition, the residents that you see in our program are, by HUD's definition, they are still homeless because they're in our program, which is a permanent supportive housing program. So if they ever make more than the average median income, then they've basically graduated out, and they can afford an apartment on their own.
So when they get to that point, do you like gradually filter them out, help them find it?
It's a celebration. Yeah, no, when someone gets their income to that point where they can pay the full amount of the apartment, it's a huge celebration, and we're helping them with where they want to relocate to, helping them with that apartment. And normally by that time, they're telling us, "Hey, I'm moving. I'm working on this," because it's normally come with an income employment job.
So you don't just like remove all of your support?
Oh, no, no, no.
Okay.
No. That's the plan for everyone. The plan for everyone on day of entry is to, one, apply for a type of housing support that doesn't have the services that we provide. That's just more of a rental assistance. That's what everyone applies for. And the second thing they're applying for, or that they're doing, is making sure they're linked to a doctor, because they've come to us because of either a risk or they're HIV positive. So the question is, okay, if you're HIV positive, are you virally suppressed? Does anyone know what virally suppressed is?
It means that the disease isn't splitting up and getting worse. It's just
Right.
maintaining.
That's right. So, and there's a strategy called U equals U. Oh, yeah, there we go. U equals U, which is an international strategy. That's how we end HIV internationally. Is for people, for 100% of our population, all of us, to be tested for HIV at all times. Just like when you go to the doctor and check your diabetes or cholesterol, check for HIV. So if everyone knows their HIV status, then if you're negative, you're just living safe practices. But if you're positive, you're getting to the doctor and you're getting on medication. Because if you're on HIV medication, then the viral loads become suppressed, and it's no longer possible for you to infect others through sexual contact with HIV. So that's what's called making you undetectable. And so the U stands for undetectable equals untransmittable. So that's how we're able to do that. So we're able to do that at a 95% success rate within 6 months of residency. If someone comes here and they're living with HIV and they're not virally suppressed, we get them tested, linked to the doctor. Within 6 months, they're virally suppressed at a 95% success rate.
You don't employ any doctors here, do you?
We do not employ any doctors.
Or any healthcare professionals at all? Or just?
Just our social work. We do have certified nursing assistants, and we partner with the physicians. We have the choice. It's a choice of the residents for their pharmacy and their primary care. So we partner with a lot of clinics to do their linkage to care. And we just make sure that they're able to go. Question? Okay, sure.
So how do people typically find ASD since you don't brand as, that housing thing? So how do they locate?
Great question. How do people find ASD? So people find ASD. We have an outreach team. So we're partnering with the medical clinics as well. So in those medical clinics, we have flyers. So if someone tests positive at a clinic, we're immediately part of the information packet that they provide on services and options, because that's a highly emotional time of a diagnosis of HIV. So there's counseling involved with that, but as well as resources. And a lot of times our outreach team might come out there. But that's what this center is also for. They will come here and do an outreach or an application for our services. So besides just kind of networking with providers and doing outreach, that's how people are able to find us. Yes. I love the questions. Shoot.
So in cases of homelessness, how does their application work? Because generally speaking, when it comes to finding housing, you have to put like X amount down, there's amount down. And when you're homeless, you don't necessarily have that. So is that a different process? Do you still require some amount of money? How does that work?
Great question. So in cases of homelessness, first of all, we try to come to meet them where they are. We will try to come to the shelter or come to their location or get them brought here or bring them here. And then work with them on an application, which really mostly means just qualifying information, your photo identification and verification for your children and all those kinds of things to verify. Income is not a requirement. Sobriety is not a requirement. We're a housing first organization. So the whole goal for us is just to verify that someone is eligible as quickly as possible. And depending on the family size, the unit may or may not be available. But as soon as it is, they're able to get housed. And on day one, or really before that, while they're on the waiting list, that case manager is working with them on resources, food resources, transportation resources, income resources, so that when they get in, they kind of hit the ground running, so to speak. But also, we kind of provide some basic needs. That's some of our volunteer advocacy as well, that we fundraise for, like the welcome baskets, toiletries, feminine products, hygiene items, things like that, like clothes, furniture, cleaning household items. We provide that as well, so that they're just not coming into an empty square room to live in. So we try to give it as normal, make it as normal as possible. Yeah.
Two
Yeah.
separate questions.
Sure.
Okay, so of that, do you offer any kind of programming to promote sobriety in any way? Or is that not something that you do?
Yes. So yeah. So when I say housing first, or you don't have to be sober to be housed, I mean, there are organizations that will say, okay, part of your application, okay, go in there and pee in a cup and come back, and we'll let you know if you're clean, then you can come in here. Or if you're clean for 6 months, then you can. We don't do that. We house you first, but we do have linkage. So when we sit down with someone, like I said, mostly on the waiting list side, when they're doing the application, you've gone through a profile. The whole application is telling them about themselves and their needs. So that case manager is really assessing all those needs that they're going to be trying to help someone with. Because sometimes there may be a linkage that they can offer that person while they're on the streets that says, oh, okay, well, wait a minute. If you just need this, you can go to this organization and actually be housed and even not come to us. That is possible. But when it comes to sobriety and recovery, we work with a lot of inpatient and just outpatient recovery organizations. They come to our space, we go to their space, we send people there, and we host AA groups, NA groups. We do all of that here as well. Yeah. Sobriety is a big issue, as well as mental health counseling, and linkage to that. When I say linkage to care, I don't just mean the primary HIV doctor. I just mean it could be the heart specialist, podiatrist, whatever doctor, whatever health care they need. Again, because now they have a partner, a medical case manager, working with them day to day on their care needs, on their health needs, and they do a 90-day kind of care plan to talk about, okay, let's set these goals for health, and then the other side they have a housing case manager, so let's set these goals for income. So they're working together to kind of help people grow.
So
Wait.
oh, sorry.
One more.
Please, you guys go.
Can go on. Second final question.
Okay.
Yes.
Okay, I was going to ask about challenges that ASD has experienced in the line of this work. I know it's a lot of complicated work. So what are some of the challenges you experience?
Money. Money is the number one challenge, because I think we believe, and I say money because we believe our model works. We've proven our model works. We've have so many graduates that go on to live independent lives, and their families are thriving, and children are growing to college. The model works. We've got a waiting list of 330 people trying to get into our housing, and we're full all the time. So the challenge is having revenue to, one, handle situations like now where there's so much federal funding kind of unrest, or just ambiguity right now. But we believe the model works, so just the funding is the only main challenge, and spreading the word, because again, we believe we kind of market our services with one of our hands behind our back, because because of confidentiality and HIPAA and things like that. We don't overbrand things, and there's still so much stigma tied to people, not just with HIV, but just to homelessness or services. Like, a lot of people don't want other people to know that they're getting help with mental health, or getting help with sobriety, or that they're in recovery. People are private. So the way we are able to market is just not the same. It's not like, normal marketing. So that's a challenge for us too. But again, these are the ways that we combat that. This is our solution to those problems. We believe that the messaging that you might have, it might be 3 years from now when when you're talking to a class about your graduate studies and how you came to Dallas and the story of the experience that you had might inspire someone else or might lower some stigma or might give someone the confidence to go get tested for HIV. You just never know. So we believe this is part of the solution as well, just talking to people like you from different walks of life. Yes.
ASD limited to Texas, or anybody at all can apply for it? Like, in terms of housing? Can people who are victims of HIV in other states also apply to ASD?
As long as you have residency or that you're located here in the Metroplex, we serve the surrounding 9 counties of Dallas County. Then they're eligible for our housing. Now, obviously, we don't have housing in other states or cities, but as long as they're here, and yes, they can come here and we provide housing for them. Yeah, we've done that. We've got people from all over the world living here, different zip codes and different countries. Yes.
Are you able to provide a family first kind of mindset? Because in homeless cases, a lot of children are going into foster care and are separated from their families when they become homeless. And it's difficult for them to get their children back.
So that's a great question. And yes, so again, what we focus on is the care manager working with what's known as the head of household. And that person is the eligible person. And in rare circumstances, it might be a child that's the eligible person, but most of the time it's the adult. And since they're care planning on personal goals that the adult, that individual has for themselves, family unification, reunification is made a priority with that care team. So the care team is working with the family in its entirety. You'll see upstairs from where you're staying, there's a kind of a children's learning area that we've created to actually help the parent with having an extra resource for children to be able to learn, get on the computer, do some homework, study in a positive, constructive area. But yes, family reunification, and we've seen it successfully. We've helped a lot of parents because, again, when you're homeless, CPS or Child Protective Services is not going to give you that 5-year-old back when you're on the streets. But we've got so many stories of success when the resident is not only in our housing, but thriving. And we've got health improvements. We've got stabilization, all these things that have happened in a measurable way, quarter after quarter after quarter. So now tell that CPS team, like, hey, let's get the child back to this parent and they come out and look. They come out and tour the property. They come out and look at that unit. They look at the paperwork, and we've had children be able to come back home to their parents because of that. Yeah. And once that happens, again, that's again when I say it's from a range of goals for individuals because everyone's individual, but getting people back to socialization because homelessness can be so isolating. It's isolating. And a lot of times when someone gets into homelessness, we're not talking about not like one night homeless or slept in your car one night or whatever, or slept on your buddy's couch. We're talking about chronic homelessness, sleeping under the bridge for 5 years or something like that. Is totally different. Traumatically, the trauma that's tied to that, the violence that's tied to that. So back to socialization. Those are baby steps to come into a big old fancy apartment with 20, 30 other people there. You don't just overnight learn to, oh, hey, how you doing? Yeah, my name's Erica. That just doesn't happen. Those are things that people are working and that care team is working on because it's a gradual process. And those you have triggers. And we train the team on trauma and trauma-informed care and how to engage people, how to not to have biases of your own situation towards the person that's you're working with. We have to train through that. And it's not a quick fix. It's an ongoing reinforcement for staff and residents to learn. And then to get together and socialize, it's a lot. It's a lot, and it's real. I think you'll see some things in your while you're there. Hopefully safe, but real life situations in the residence, just no different than it would be like you see some people arguing in the dorms. Yes.
My question is about the system. You mentioned earlier when I was asking about challenges that the system works, it's just revenue. So, as someone who has been working here for quite some time, what are some of the things that have strengthened the working of the system? And I'm asking this because I also work in the non-profit sector and I would want to build something sustainable. So, what are some of the things that strengthen your system here?
Yes, good questions. So, let me just say it this way. Let me start by saying I think having a good team is so critical. None of the, like what you're seeing today, you may see 5 minutes of something like, oh, that was nice. Not knowing it took hours or months or weeks for someone to put together. The team we have behind the scenes, you just have to have, I think, and it's hard to retain and keep. But I think for nonprofits, in my experience, my background was in housing. When I was at Kansas State, I was doing, I was taking student athletes to Junction City to the elementary schools to talk to kids about mentorship and sobriety and not doing drugs as kids. Student athletes we were taking. So I think but I did that because that's how my upbringing was wanting to just help someone else just based on my personal experience. My personal experience was housing instability here. When I lived here, we were evicted, we were foreclosed, as a teenager and as a college student coming home and my stuff is on the curb. So as a kid. So my background has always been into housing. Since then, I've been in this field for 26 years, always in the affordable housing side, because I believed that housing was pretty impactful. Like home, where you go to sleep, it really is kind of like a foundational piece of a lot of things that you do. People don't realize it or not, they take it for granted. So I think that's a strong point for our organization. That's one of the things that gravitated me here in 2011 was that the organization had built housing for its residents. In 1987, having that vision was so paramount. And here, what you don't see is the neighborhood was protesting them not to come here on that street. We've got pictures where they were protesting, saying, hey, we know you're dying, but you can't take us with you. No AIDS colonies here. And Jesse Jackson came down here and, elected officials came to educate people like, hey, you're not going to be sick because people, like they were delivering the mail in hazmat suits and dumping it in trash bags. But the housing that they wanted to provide to give their friends respect, justice, and mercy so that they could just die with dignity. That's really how the founders were really focusing. Their friends were dying. They just wanted them to die with respect. So they did it in their house. Then they got another property. So that stabilization in America, housing is a critical foundational piece. So again, that inspired me. And when I came here, my predecessor, allowed me to push that vision to get that next property, La Maison, because we own those properties. And since we own those properties, when the area develops or changes over or gentrifies, they can't push us out. And I've already talked about, they didn't want them in the first place. But when you own the property, it's not like a rent passing back and forth. So we bought this property. Same thing. The concept of being, there needs to be some kind of root stabilization for the nonprofit. And for us, it's housing. And the strategy for housing normally is through development for us. And that's been our root issue. That's how it's allowed us to have stabilization for 38 years. You and then you.
So you mentioned that there's a wait list for residents. Do these people on the wait list still receive any sort of assistance, or does that all kind of start once they move in?
They don't get housing assistance, but yeah, we're trying to link them to the doctor trying to link them to, some transportation needs and some food resources while they're there and unhoused. But it's still a struggle. No, while they're unhoused on the waiting list, they're not getting housing. That's the main thing.
So how do you know when an individual makes above the minimum income?
We do what we call income verification. It's a questionnaire as well as a verification through the system, employment system, to see what kind of income is coming through that individual's EIN or a social security number to verify their income. So I don't know if I said this, but if you do earn income, we cap the rental expense at 30% of your earned income. So that makes it affordable. If you're paying no more than 30% of your income towards your housing, then you have 70% to pay for everything else: clothes, food, transportation. So that's how we make it affordable.